Hello everyone, welcome to this session of Anesthesia Super Speciality MCQs Part 9. And today we are going to discuss the rest of the MCQs from IV anesthetic agents as well as a few from local anesthetics. So, as we all know, we have completed all MCQs of anatomy and physiology related to anesthesia, and now we are on to the pharmacology in anesthesia part. So, all of these MCQs have been picked up very thoroughly from all the topics that are asked about the different kinds of drugs in anesthesia. We have focused on the intricacies of inhaled anesthetics, IV anesthetics, local anesthetics, opioids, as well as muscle relaxants to make sure that you cover the entire topic. And if any kind of question comes in the exam, you'll be able to tackle it well. So let's go on with our first question for today. Reverse coronary stale phenomenon is seen in which IV induction agent? Ketamine, propofol, etomidate, or thiopentone?